Hidden decisions no one tells you about breast cancer. When people are diagnosed with breast cancer, they often expect the journey to be very clear. A diagnosis, followed by a protocolized treatment plan with no decision making. But in reality, this is slightly more complex. Many treatment decisions are not black and white. Modern breast cancer treatment is highly advanced. We tailor treatments based on tumor biology, stage, genetics, and individual patient factors. But even with all of this information, there are still areas of uncertainty, and this is where decision-making becomes more complex. At the heart of most treatment decisions is a simple but important question. Does the benefit of this treatment outweigh the risks and side effects? For example, chemotherapy might reduce the risk of cancer returning, but it also comes with short-term and sometimes long-term side effects. Complex oncoplastic breast surgery can improve the shape and appearance of the breast, but can also lead to complications. So the question becomes, how much benefit is enough to justify that treatment? From speaking to hundreds of patients and from themes that we see in patient communities, this is where many people find things most difficult. Because you may be told, this surgery or this treatment reduces your risk by a few percent, but it may significantly impact your quality of life. And naturally, patients ask, is it worth it? What would happen if I didn't have it? This is where understanding risk becomes very important. There is a difference between relative risk reduction and absolute benefit. For example, a treatment might reduce risk by 30%. But if your starting risk is low, then the actual benefit may be small. So it's important that you know what your current risk is, and therefore that starting risk and the risk after the suggested treatment. And this is where personalized decision-making becomes essential. Another important aspect, and often not discussed enough, is quality of life. Treatment is not just about survival. It's about how you feel during treatment and how you recover afterwards, and how you live your life beyond cancer. Some patients prioritize maximizing survival at all costs, and others prioritize maintaining quality of life and minimizing side effects. And both approaches are completely valid. It is our role as clinicians to understand this priority and help you achieve your goals. Our role as clinicians is not simply to recommend treatment. It's to help you understand the numbers, understand the uncertainties, and make a decision that aligns with your values. And this is what we call shared decision making. Breast cancer treatment is not just about following a protocol. It's about making informed choices in the face of uncertainty. And that can feel uncomfortable, but it's also empowering. The good news is, treatments today are more effective than ever before. So outcomes continue to improve, and we are increasingly able to tailor treatment to the individual. If you are facing any of these decisions, you are not alone. Ask questions and take time to make the right decision for you and truly understand what treatment choices there are to offer.